Hello, everybody. This is Terry with the Premom team here with Brianna Kane, registered nurse, for part 2 on fertility treatments, because fertility treatments part 1 went so well and we wanted to make sure we covered more information. And thank you for your feedback on our announcement post. We are considering doing some evening spotlights based on your feedback, because we want you to see these. We want you to be able to participate. And we might even turn this into one of our classes. So watch for information on that as well. We do post these in YouTube. We do post them in the units in the Facebook group, and they are also on your app. So sometimes it takes a day or two for it to actually be edited and posted, but they do go in there. So make sure you check it out. There are a lot of great spotlights and panels in there. I'm really excited about those and today's. So you should know a little bit about Brianna already, but Brianna, why don't you just give a quick overview of who you are before we jump in?
Okay, hi everyone. Okay, so I'm excited to be back here and do fertility part 2. So real quick, if you are interested more, you can see my kind of page on the app. But basically, my background is in fertility. I was a labor and delivery nurse before I moved into fertility. So I have been an IVF coordinator. I've ran a clinic, a couple clinics actually, and managed those. And then I personally have had IVF as well. Actually, every type of IVF or fertility treatment up into IVF. Before conceiving with IVF, I have a 2-year-old son, and went through fertility for a total of actually 7 years before I had my son. So I know what it feels like to be a patient. I know what it feels like to also be kind of on the fertility team and kind of the ins and outs of what to expect when you do think about fertility treatment. So that's what we're going to talk about today, is just kind of all things fertility. If you're interested, if you're already seeking fertility treatments, that kind of thing.
Great, and thank you for that reminder. Yes, you can find Brianna right in your Premom app. I was told I need to mention this at the beginning of the video because some people are, get busy and don't watch till the end. So make sure you check out Brianna and our consultants under schedule a consultation, which is in the more section, the bottom right of your app. And then you can get personalized treatment there. We wanted to start with IVF appointments and what to expect in general. And someone specifically had a question about blood tests.
Yeah, so when you go to seek fertility treatments, okay, first of all, they're not just going to bombard you with a lot of things. They're going to talk to you first and kind of get an idea of what's going on in your body, how long you've been trying to conceive, kind of what your specific situation is. And depending on what's going on behind the scenes, if you're having regular periods, if you're having other symptoms, how long you've been trying to get pregnant, your age, a lot of different factors, they will order some tests. Again, this is completely going to be dependent on what's going on with you. They're not just going to run the same test for every single person, but on average, typically they test for your ovarian reserve, okay, to see kind of where you're at. And then they test for certain hormone levels like FSH, follicle stimulating hormone, estradiol, LH or luteinizing hormone, progesterone, prolactin, vitamin D levels, those kinds of things, just to kind of get an overall picture of whether you have, hormone imbalances anywhere, look to see where your ovarian reserve is, and then also just to see if you're kind of an overall generally healthy individual. So those are kind of some things real quick about your anti-Müllerian hormone level or your ovarian reserve. That's what would test your ovarian reserve. That is just kind of an indicator for us how we should base treatments and how aggressive we should be with treatments. That does not mean, like, if someone has, I get this a lot, if someone has a low anti-Müllerian hormone level or AMH, which is what represents your ovarian reserve, that does not indicate that you can't get pregnant on your own. Okay, that only means that at your specific time, your age currently, that tells us how aggressive we need to be. So if it's much lower than we expect, then we may look at more aggressive treatment options. We may look at higher dosage of medication. If it's a really good, healthy range for your age, then we know that we can kind of take a deep breath, and we know that we've got some time to work with. So that's important, but it does not determine whether you can get pregnant or not on your own. Okay, I've seen low levels, and women are able to get pregnant on their own, no problem. Okay, so again, it's just kind of an indicator for us. This patient kind of had some general questions about IVF. Basically, IVF is just where we try to induce ovulate, or not really induce ovulation, but induce the growth of multiple eggs at one time. And then we retrieve that with a procedure in the office. And we take those eggs, and if they're nice and mature eggs, we mix them with sperm to create embryos outside of the body. So in a laboratory where embryologists are kind of, basically babysitting your babies really early on. And then if they grow and develop the way that they should outside of the body, they're placed back into the uterus somewhere about 2 to 5 days after your egg retrieval. And then hopefully pregnancy will occur. So IVF basically has some benefits because it kind of bypasses the natural way of conception. So an egg doesn't have to be released and go down the fallopian tube to meet a sperm. And so because of that, those things happen outside of the uterus. And so sometimes for specific situations, that's a better option. It also does increase your chance of pregnancy depending on what's going on, so sometimes women of older age, they're not able to have the same pregnancy rates as someone who's 25 or 30, with IVF, but it does increase your chance of pregnancy kind of per cycle compared to intercourse or IUIs. So yes, that's a very quick general term of IVF, but there's a lot of information out there, and a lot of resources. We're currently even working with Premom for some resources to be able to kind of go to get a quick idea of what IVF is and get all of the information you need on that.
Great. All right, and if you're watching live, please feel free, if you would like, to ask some questions, because Brianna's open to answering some questions live. But let's go on to another question about IUI. Someone was asking about how to be successful with IUI and the difference between injectables and Clomid and Letrozole.
Yeah, absolutely. So this person basically was saying that their doctor recommended IUIs with injectable medication, and she just kind of wanted to know what the difference was between IUIs with injectables versus using Clomid and Letrozole, which is typically kind of like the first step. And what's better? And there's really no right answer, because again, it depends on what's going on in the body, but it's important to know what Clomid and Letrozole does versus what injectable medications do. So Clomid and Letrozole are commonly used for timed intercourse, for IUIs. They're kind of like the first line of defense a lot of times when people have ovulatory issues, or they just want to increase their chance of pregnancy. So with Clomid or Letrozole, basically what the medication does is it tricks your brain into thinking that your estrogen is really low, which basically kicks your pituitary gland into high gear to produce some of these, hormones like follicle stimulating hormone and luteinizing hormone to develop follicular development. Okay, so it tricks your brain and makes you develop these hormones on your own. Okay, whereas injectable medications are actual hormones that are injected into your body. So backtrack, the Clomid or Letrozole, you're still producing those hormones on your own. Okay. Injectable medications, you may still be producing those hormones on your own, but those injectables are extra hormone that are injected. So injectable medications are a lot more aggressive. They are typically used for IVF cycles, and they are a lot more expensive. So that's another thing to think about, is that, you know, the expense of an IUI is relatively low compared to IVF. But when you add injectable medications, that's a big chunk of money. These medications are very expensive if you don't have coverage. And so they can usually range about, I would say, for an IUI, $1,000 to $3,000. It depends on how long your cycle is going to be. Okay. So with these Clomid and Letrozole medications, you know, you're kind of producing the hormones on your own. And because of that, it doesn't, it's not as aggressive. And so therefore you usually only develop, you know, maybe 1, 2, or 3 follicles. That's pretty typical of Clomid or Letrozole. With these injectable medications, the purpose of them is for IVF, to produce multiple eggs. But with IUI, we don't want you to produce multiple eggs, because your chance of multiple pregnancy is very high when you do that, because you're ovulating on your own. We can't control how many babies, you know, you were to actually get pregnant with, if you actually you know, if you actually ovulate more than 1 egg, right? We have no way of controlling that when you naturally conceive with IUI. So there is a problem with that potentially. So with injectable medications, the goal is to go low and slow. So we start injectable medications usually at a very low dose, much lower than you would with IVF. Okay. And then it takes a little bit longer than IVF to develop dominant follicles. The risk that you have with injectable medications is, of course, that you can develop multiple follicles to where your doctor may not want you to move forward with an IUI, and you would actually have to have it canceled because, again, that risk for multiple pregnancy. I would say, you know, don't hold me to this, but every doctor is completely different. But usually when you get above 3 follicles is usually when they think, hey, we need to cancel this cycle. So you have to think about the fact that you could be, yes, your development of follicles is greater and you have a better chance of developing follicles, but you also have a higher chance of canceling that cycle and kind of wasting the money of the medications. And then also it does require blood tests and ultrasounds to kind of just track how these injectable medications are working. So that's kind of something to think about. But I will say, that sounds all negative, but I will say that there are situations where patients do not respond well to Clomid or Letrozole, and this would be a really good option for them, especially for people who, like I said, don't respond to the Clomid or Letrozole, and then also for people who have low ovarian reserve. So maybe it's harder for them to develop multiple follicles. So for them, this might actually be a great option, and their chance of their cycle being canceled is very low because they don't typically develop more than 1 or 2 follicles anyways, because their ovarian reserve is low. So it's not a bad option in any way. It has its purpose, but for a normal ovulating woman, they wouldn't want to just jump to this option right away because it can be a little dangerous as far as having lots of babies.
Wow, thank you for that very thorough explanation. Learning something new. Okay, let's go on to, you mentioned briefly the expense of some of these parts of these processes, and someone did ask about if there are resources to help with these expenses. Can you talk to that?
Yeah, absolutely. Okay, so this is really important. I hope lots of people are listening and jotting down notes. Okay, this is important. Okay. So when you are thinking about IVF, first of all, and this may be, you know, old information for some people, but first of all, you need to call your insurance company and find out if you have fertility coverage. That is super important. Okay. A lot of people have no idea. They think that, hey, IVF might be an option, but they're like, really, I have no idea. I talk to people with my fertility consults through Premom all the time, and they're like, yeah, I have no idea. So it's important to call your insurance company, they'll walk you through your benefits and let you know if you have fertility coverage or not. If you do have fertility coverage, you need to ask them what providers they want you to go see, because there are some insurance companies that require that you go to certain physicians, and that's where you're going to get the most out of your benefit. Okay, so you definitely, of course, you want to go somewhere that you feel comfortable and all of that, but because IVF is so expensive, you definitely want to make sure that you're going to the right clinic that your insurance will work the best with. Okay, now if you do not have fertility coverage, I'm one of those people. I worked in IVF and I didn't have IVF coverage, so I understand the brutalness of that. Okay, it's not fun. So basically, if you don't have fertility coverage, if you do have insurance coverage, basically, as long as you go to a fertility center that does accept your insurance, even though this might sound confusing, even though you don't have fertility coverage, if they accept just your general insurance, a lot of times your consultation fee when you first go to see that fertility specialist will be covered, or you'll just have to pay a specialist copay. So some people, have like a $60 copay. That would still be, part of what you would have to do, but then insurance would cover the rest of it for that first consultation, which is really beneficial because, if you're not sure if fertility, treatments are a potential or a need for you, or you're just not sure about the cost of it and all of that, you can go to that consultation and they're going to talk to you about all of your options. They're going to talk to you about cost. They're going to talk to you about, what's going on in your body that may lean them to think that you may need something, some kind of treatment or another treatment. So a lot of information is obtained from that consultation. So if you think you might need fertility coverage or might need fertility treatments, then it's a good idea to go and have that consultation, even if you don't actually have fertility coverage, because your insurance will more than likely cover it. Okay. Again, fertility coverage can be determined through your insurance, and give you a little bit more information about that. If you don't, whether you have coverage or not, there are a lot of, things that you can do to help with the cost of IVF. A lot of clinics do have IVF financing. Okay, so they work with like third-party lenders to help you with financing for IVF. Okay, and a lot of times you don't have to have great coverage and all of that. They know that most people who need fertility coverage come from all walks of life. They're and so it's okay if you don't have great credit and all of that. That's perfectly fine. A lot of times you're still qualified, and it's usually low interest rates and that kind of thing. Or over a certain period of time, no interest rates. Like there's a lot of things like that. Also, there are usually grants that you can apply for, and they are all across the country. Literally, you can just Google IVF grants, and there's all sorts of things that you can apply for all across the country. Just know that some of these will require you to go to certain places to get that IVF done. So that's important to know as well. So hopefully you can find a place or grant that you can apply for near where you live, but sometimes it does require that you travel. But when you think about the cost of IVF, $15,000 to $20,000 on average, with medications and everything, it's sometimes worth it to, buy a flight for $1,000, across the country. So that's something to think about. So yeah, I mean, again, I guess my biggest thing is just whether you have insurance or not, and if you really think that fertility treatments are in your future, go to that consultation. It's going to give you a lot of information, and it's going to give you a kind of an idea of basically where you need to go. If you need, a year to save some money, that consultation will let you know kind of what to expect. And then usually each provider sometimes has local resources related to grants and related to financing that they can give you information on when you go to that appointment.
Awesome. It looks like we had a follow-up question. Do you see that one there?
No.
Okay. we tried. Is there anything I can do after IUI to make sure the implantation happens successfully?
Okay, yeah. So really, I mean, just lay off the kickboxing, like all the craziness. A lot of people think that they need to go home and be on bed rest. That's not the case. It can actually hinder your implantation. You need to kind of be normal and moving, but like I said, not doing anything super crazy. Okay. So that's pretty typical. Not being stressed out, just kind of relaxed, mindset. When your mind is stressed, your body is stressed. And so I think there's a huge correlation to that. Usually they will make you, after an IUI, they will make you kind of sit still for 10 minutes. Some places do 30 minutes, like just laying flat, to allow kind of the sperm to travel where it needs to. But really, I mean, like I said, just trying to be as relaxed as possible, taking your mind off of things. And then another thing that is definitely something that the clinics that I worked at, we were a huge proponent of, is after you have your IUI, go home and have sex. that increases your chance. It doesn't hurt anything in any way, shape, or form. So yeah, I mean, maybe not right away, but like later that evening, you haven't ovulated yet. An IUI is scheduled before you ovulate. So, increasing your chances some more and having intercourse. Again, if that's a possibility. Of course, I know like some people have IUIs because they use donor sperm or, other things, and that's not an option. But if it is an option, do it.
That's really helpful to know. Let's get into some of the irregularities or causes for why someone may want to receive this treatment. There was a question about periods. Can you talk about like missing periods and the chances of regular periods but not ovulating? Just get into periods a little bit.
Yeah. So someone asked if you can have regular periods and not ovulate. The short answer is no. So your period is a direct response from ovulation. We talked about this a little bit in part 1 of fertility treatments, but basically, when you ovulate, once you ovulate, your progesterone starts to increase. And that progesterone stays elevated until your body determines if you're pregnant or not. And then once your body determines that you're not pregnant, then the progesterone level kind of plummets, and that's what caused you to have a period. If you are pregnant, then that progesterone level stays elevated and supports the pregnancy until about 8 to 10 weeks gestation. So really, if you are having regular periods, you are ovulating. It's just, it's common that sometimes, you've got to get used to using those LH kits, that kind of thing. Make sure that you're testing at the right time, not using diluted urine. There's a lot of things that go into it. Once you master it, it's like the back of your hand. It's super easy to do, but it's not easy right away. So it's not one of those things that, oh, I need to start taking LH kits and then it's just like easy peasy. It's not like that. It kind of takes some getting used to and some practice. So don't be discouraged if you're not getting positive LH kits. Also, there are some conditions like PCOS and that kind of thing that sometimes can cause you to have, irregular LH testing results. It's not super common, but it is possible. So, I mean, basically keep trying. That's all. That's all I want to say about that. And then skipping periods, I think someone asked, like, they skip a period once a year. If I'm reading that correctly, that's just like one period out of the entire year that they skip, usually because of anxiety. So periods can be manipulated by a lot of things. A lot of times our stress levels, anxiety, too much exercise, not enough exercise, weight gain or weight loss. There's a lot of things that can affect your period, either, in your bleeding. A lot of these things do cause your period to kind of be abnormal. It's not a huge deal if you were to skip a period once every so often. That's not going to hurt anything. Like we have a lot of PCOS patients that, they go 3 months before they have a period, and they're okay. The issue is that when you go a long period of time without a period, if your lining is building up, so each month when you do ovulate, your lining kind of starts to develop and to prepare for a pregnancy. And if you don't actually have a period, then your lining can't shed before a new lining starts to develop. Okay, so basically, if you go a long period of time without a period, then lining after lining after lining starts to develop on your endometrium in your uterus, and that can actually be a really great environment for cancer. So it's very important that you do have pretty regular periods, but again, this would not cause the having missing one period every random time would not cause you to be concerned about cancer or something like that. But having very irregular periods, going months and months and months without periods, going a year without a period, that is concerning, and usually needs to be kind of addressed. You need some help to have regular periods. And then you also might need a doctor may recommend you have what's called an endometrial biopsy, where they basically take a little chunk of your lining out and they test it for cancer cells. And so that's important. So, in fertility, we do get a lot of patients who say, oh, I haven't had a period in a year, and they're just now seeking, help. That's dangerous and that's scary. So it is really important that if you are having, going months and months and months, like probably 6 months or more, and you haven't had a period, you need to call your doctor and get checked out.
Okay, I have a follow-up question to that just as I'm listening to you talk. Besides irregularities with the menstrual cycle, what are some common, and obviously not being able to get pregnant, what are some common symptoms that people will come to for these type of treatments, just that they think something's wrong?
Yeah. So a lot of times it's really just your inability to achieve pregnancy over a long time span. So, and I was one of them. A lot of people don't seek fertility treatment for quite some time, but really it's recommended. I know I'm a broken record from my last video, but it's really recommended that if you're under the age of 35, you need to give it about a year. If it takes about over a year to get pregnant with this tracking, your cycles and tracking your LH, and you're still not getting pregnant after about a year, then you need to seek, help. Not necessarily do you have to go to a fertility clinic. You can seek your OBGYN. Some primary care doctors even do it as well. It just depends on what your specific physician is comfortable treating. And then if you're over 35, it's really recommended that you give it about a 6-month window of tracking your cycles, trying that timed intercourse, having intercourse around ovulation and all of that. And then if you're not getting pregnant, to go ahead and seek treatment, because as we get older, our ovarian reserve decreases. There's more complications and risk to getting pregnant as you get older. And so sometimes you do need a team of people to really help you. Also, it's important that you don't give it too much time when you're over 35 as well, because your chances continue to decrease as you get older. So we want to make sure that we help you while you still have lots of options available. The longer you wait, the less options we typically have. So, but yeah, so overall, really it's typically people are just not getting pregnant, and that can mean a number of things are going on. And I want to say real quick too, this is a good place to stick this in, is that it's not always the woman. About half of the time it's the man. So it's the male partner. So I know women who, I have talked to so many women who say, well, I ask, has your partner gotten tested? Oh no, I know it's me. No, you don't. No, you don't. It may very well be your male partner, and it doesn't matter whose issue it is. What matters is that we address it. And so there are a lot of things that can be done on the male partner side as well to help with fertility. And people don't know that, things can hinder it. Like they're, drinking too much alcohol, smoking can hinder sperm count. Obesity can affect sperm count. It can affect the motility and the concentration, how many sperm are actually in a sample, and then how many sperm are actually moving. So there's a lot of things that that the man can do too. Okay, it's not all the women that have to take on the burden. So yeah, there's a lot of different reasons to seek fertility treatments, but I would say most of the time it's just that there may be some underlying things going on that need to be corrected, but it usually is presented as they're just not able to get pregnant and things are kind of functioning as you would expect them to. And it's just because some of those underlying symptoms don't show up in our everyday life of trying to get pregnant naturally.
Awesome. I'm glad you remembered to talk about that, because I know we just had that panel last Friday. We were talking about weight and fertility, and you said, I forgot to talk about men. So
No.
glad you remembered.
No, I was so mad that I didn't mention that, because again, women just, we do, no matter whose problem it is, even if it is determined that, there are male factor issues, women like to take it all upon themselves and say, well, it's my body, I should be getting pregnant, and it's my fault. First of all, it's no one's fault, but that mentality is not going to help you get anywhere. Blaming yourself, that just adds more stress and adds more anxiety to the whole situation. So, I hate that if you're watching this and you're struggling with fertility, I hate that you have to do that. I hate that I had to struggle with fertility, but it's no one's fault. It's a reality. And luckily there are just so many people, so many things that we can do to kind of combat this. And that's what I love to do. That's why I love Premom. That's why I love what I'm doing, is helping women become mothers, because, we are the most aggressive kind of population of people, because we won't give up. We don't take no for an answer. We will do anything and everything that it requires. But a lot of times that means that we'll do it all on our own, and we don't have to do that, So that's my little spiel. I'm done with that.
Love it. We do have another live question. We'll see if we can get a couple more live questions before we start to wrap this up. But the question is, if you have a high ovarian reserve, higher than normal, is that good for IVF?
So yes and no. So I would have to know really what higher than normal really looks like. If you're getting too kind of high, that can be actually indicative of polycystic ovarian syndrome. Okay. So when you have a high ovarian reserve, it's good in the fact that you're probably not going to have any trouble developing follicles, okay, and getting lots of eggs with IVF. On the flip side, though, is that you are actually at risk for what's called ovarian hyperstimulation syndrome, which is a very serious kind of syndrome that can be developed from IVF treatments. Basically, when so many follicles are developed at one time, there can be this extra fluid that builds up, and it can actually cause extra fluid buildup on the abdomen and the lungs, and can actually cause you to be really sick and lead to hospitalization and sometimes even death. That is very rare, though. And the reason why is because we as your medical team, as your fertility team, know what signs and symptoms to look out for. So it is serious, though. It's something to think about. But usually, you have a team of people behind you who know what to assess. And then there's also, if you start to develop signs or symptoms of ovarian hyperstimulation, there's some medications that we can give you to help combat that and kind of quiet everything down and keep you from actually getting sick. But with people who have really, really high ovarian reserve, we just have to basically constantly be balancing the whole IVF process with not giving you too much drugs, but also making sure that you have a good amount of eggs to make IVF successful. So we kind of monitor you a lot more closely, because we know your potential for hyperstimulating is higher than someone who has a normal ovarian reserve. Okay. So if you're talking about, I just have a normal ovarian reserve for my age, then no, you're not at risk. But when you have like a really elevated, way above normal range, that's when, and usually it's because of PCOS. If you're a 21-year-old doing IVF, you may have a really high ovarian reserve, and that does not put you at risk for, ovarian hyperstimulation. Okay. Not necessarily like it would with PCOS. So there's just it just is very dependent on what's going on. I would just have to know more details to really know for sure. But if it's way above normal, then it is not necessarily a great thing, but it doesn't mean that IVF won't be successful for you. It just means we have to be really careful moving forward.
Good to know. All right, we did get another live question. Tips for getting prepared for the IUI process. I know we talked about that earlier, but any
yeah, so that, I think we talked a little bit about before or after, sorry, IUI. So before, I mean, again, talking about, not being stressed out, that's a big indicator. Making sure that you're doing what you need to optimally do to help that sperm sample. So a lot of times, like I said, I recommended that you have intercourse after an IUI, but you don't want to have intercourse too soon before an IUI, especially if a semen analysis indicates that there are some mild male factor infertility issues like low concentration of sperm, low motility of sperm, or low morphology, which is kind of basically how normal the sperm appear under a microscope. So if any of those parameters are a little off, then typically your physician will recommend that you abstain from intercourse like 2 to 3, 4 days before you have your IUI. If you have normal sperm parameters, everything's fine, then a lot of times they don't care. But it just depends. So that's one thing to kind of think about. Overall though, this doesn't necessarily just, go for patients having IUIs, but overall, just thinking about yourself as being pregnant. I think we've talked about this before, but, eating right, taking your vitamins, prenatal vitamins, folic acid, vitamin D can be helpful. Eating right, exercising appropriately, basically just trying to be your overall healthiest self will help you achieve pregnancy. Anytime, anywhere in our body is struggling a little bit more than in another area, it takes away, it basically steals the thunder from the reproductive system. So if anything is off, health wise, if you have, blood sugar issues, or if you're overweight, or I can't think of it, blood pressure issues, like if there's some major things going on, then your body can't really, focus on what it needs to do in your reproductive system to achieve pregnancy. Doesn't mean that pregnancy won't happen, but it just means, if you're talking about trying to optimize your chances of pregnancy, it means that your body's not functioning the best that it possibly can. So doing everything you can to just be healthy as possible, and think of yourself as a pregnant person, eating nutritious foods and that kind of thing is going to go a long way. And again, I know I started with that, but stress levels, stress. And trying to, just keep calm, whatever you need to do to help yourself, not be anxious through the process. I know it's easier said than done. I'm sure people are rolling their eyes at me right now. And so I know that it's easier said than done, but whatever you have to do, I think I've talked about this before again, if you have to get, massages help you. If you need, your partner to give you a foot rub, whatever it is, if you need to go read a book, if you need a day to go shopping, whatever it is, to kind of keep your anxiety low, keep your stress levels low. And again, have people around you to help you through this process, whether it's your fertility team, friends, family, your partner, whoever it is, to help you along the process. Don't do it all on
Awesome. All right, we have another live question. Someone has been trying for a year and a half. Okay. And they've done the blood work and had the pelvic and probably transvaginal ultrasound.
Yep.
Things looking normal, wondering about potential next steps.
Yeah, so I was there. I was diagnosed with unexplained infertility, had all the tests, everything was completely normal, still wasn't getting pregnant. You fall into a really common kind of group of people of potentially unexplained infertility. They may not have officially diagnosed you with that, but if you've had a lot of these tests and everything's normal, you may fall into that category. Luckily, with unexplained infertility, it is a lot of times treated with IUIs or IVF. You're a good candidate for that. But sometimes I know you said a transvaginal ultrasound. They would also potentially do an HSG, which I'm not going to tell you the long name for it because it's really hard to pronounce. But hysterosalpingogram. I don't know. Okay, I can't say that word, but basically that checks to see if your fallopian tubes are open. So if I don't know if she's already had that done, it just didn't sound like that was one of the things listed. But if that would be kind of the next thing to make sure that your tubes are patent, because if your tubes are blocked, then there's no way you're ever going to create an embryo to result in a pregnancy. Sometimes it means that sometimes one tube is blocked and the other one isn't. And it's typical that you pretty much alternate which tube you ovulate from each month. Some women don't exactly fall into that category, but it is typical sometimes that 1 month you ovulate from your left side, 1 month from your right side, and back and forth. Well, if you have one blocked tube, then that kind of cuts your chances in half a little bit as well, because you're not ovulating from the follicle or the fallopian tube that is actually open every month. So that would be the first thing that I would look into. And then, if everything is still normal, still not getting pregnant, keep trying. First of all, it doesn't mean that you can't get pregnant on your own, but you are a good candidate for other, treatments like IUI, and if you needed to, IVF as well.
This person did follow up saying that there's also been one chemical pregnancy.
Also been one. Okay, so chemical pregnancy, I say this very lightly because I know that, miscarriages are really hard to go through. But when you do have a chemical pregnancy on board, it is kind of a positive in our eyes, because it shows that you are able to achieve pregnancy. So there are some things though that can happen after a chemical pregnancy, like you can have some scar tissue and that kind of thing that can develop in the fallopian tubes. So that is something to kind of think about. But overall, that's actually a positive thing, because like I said, we know that the egg and the sperm are able to meet and create an embryo and attach to the uterus. It just probably means that egg and sperm did not create, that specific egg and sperm that came together didn't create a normal embryo. And that's super common. So that's actually, reassuring information to know that, you're doing what you need to do. You just need to keep trying to get that one healthy embryo that's going to result in a healthy pregnancy. Chemical miscarriages are kind of our body's way of protecting us from having an abnormal pregnancy. So, your body it sounds like it's actually functioning the way that it needs to. But like I said, there are some things that you can try to help increase your chances a little bit, like IUI.
Great. And then we had a kind of a follow-up question from an earlier question.
Yeah.
This person is wondering if there have been any success stories with having one tube and 2 ovaries and doing an IUI.
Yeah. So actually, yes, I have personally had taken care of several patients who've only had one tube open that have gotten pregnant. What typically happens though is that you'll note what will go on is typically you have to have ultrasounds done with before you do your IUI to determine which side that dominant follicle is developing on, so that you basically don't waste an IUI. So if you're developing a dominant follicle on the side that is blocked, then you wouldn't go forward with the IUI treatment that month and try it, and then you would try again And then the next month, if you are developing a follicle on that dominant side, then you would go forward. So usually it does require that ultrasound testing to determine. And I have seen definitely patients who have gotten pregnant because we pinpoint it. We only do the IUI when they're releasing a dominant follicle from the side that their fallopian tube is open. And so that's very possible. I have also seen, though, where stubbornly they develop follicles consistently on the side that is blocked. And so a lot of times those patients will decide to just do IVF if they're really aggressively trying to get pregnant. So it's just how patient do you want to be? Do you want to be patient and continue on with treatments a little bit longer than the average person because some months, your follicle may develop on the wrong side? Or do you want to just be more aggressive and go ahead and do IVF because it bypasses the fallopian tubes entirely? So it's kind of up to you and how aggressive you want to get and how quickly you want to try to achieve pregnancy.
Okay, I just want to let you know you're getting quite a few thank yous since you can't see them.
Okay. Yeah, I don't know why it pops up for like 2 seconds and then it goes away.
And we have another question about, actually this is kind of neat because I don't think we covered this in our panel. What about BMI and wanting to do an IVF? Are you more at risk if you're over the recommended BMI and considering IVF?
Yes. Okay. So, so a lot of clinics actually do have a BMI requirement to do IVF. And a lot of times that's about somewhere, it ranges. I've worked at clinics where it was 35. I've worked at, which is pretty conservative. I mean, lots of women fall into that category. And then also, I've worked in clinics where it was about 37 and a half, and then clinics where it was all the way up to 40, a BMI range of 40. So the reason for that is that your risk for it not working does increase a little bit the heavier you get, okay? And then also your risk for complications with the actual retrieval with getting sedation. Anytime someone who is obese has sedation, they're at greater risk for having breathing difficulties and that kind of thing when they're placed under sedation. Now with retrievals, they're given like a moderate sedation. It's given typically through an IV, and it basically just makes you take a nap while you have your retrieval. It's, you don't feel any pain or anything like that, but you still have complete control over your breathing, okay? You don't have to have a breathing tube put in place or anything like that. But with patients who are more in the obese scale, a lot of times they have kind of some blockage in this area when they lay down. And so it can actually kind of cut off breathing when they do have sedation of any kind. And so because we're not using a breathing tube, and because we don't want to do that because your recovery could be a lot longer that way, it's typically recommended that if you are over that BMI requirement, to try to lose some weight, one, so that the success of the retrieval is better, and then also so that your chances of any complications happening during the procedure are minimal as well. So ultimately it's for your benefit, but you would just, if you think that you're somewhere in that range, you're just not sure about your fertility clinic and what the requirements is, you can just a simple phone call, they'll be able to tell you pretty quickly. Sometimes too, like some fertility clinics just require that maybe their requirement is that if you're over 35, you just have to have a consultation with anesthesia. So sometimes that's common as well. And so you may still be able to do IVF, but you have to have like kind of an extra appointment with anesthesia to basically determine, if your risks and outweigh your benefits and vice versa. There are some women who fall into that category that really don't have any risk for any complications with their retrieval. So it just sometimes it requires a little bit more kind of in-depth looking at it. Like if you snore, that's kind of a sign that you may have some breathing issues and that kind of thing. So just some things that we can look at and help you. And then if you do need to lose weight in order to have a retrieval, usually your fertility team will get behind you. They can kind of recommend some things to do, and even like some services that are available, like weight management centers and that kind of thing, to help you. Like they'll get behind you. They won't just shut the door and say, oh, lose 20 pounds and come back and see us. That's not, that's not how it is.
Goodness. Great. We have a couple of more live questions and we'll wrap this up.
Okay.
One is, thank you for your time. We've gone really long today.
Yeah, no, it's fine.
Okay, great. What advice do you have about taking Letrozole?
Yeah, so Letrozole is a good medication. It's a good, medication that can be used. It especially can be used in lieu of Clomid, like Clomid isn't working. And then also for patients who are a little overweight, it tends to work a little bit better than Clomid does, as Clomid really has been shown to not be significantly effective in patients that are a little overweight. So I mean, I don't really have any necessary recommendations, because when you do treatment, that your physician will walk you through every step. It does have to be started at the beginning of your cycle. It's usually started somewhere between cycle day 3 and 5. So if you need to be very aware of your kind of monthly cycles and how they work, to be able to do these effectively. These medications help to develop follicles just as they're starting to grow. So if you start to take the medications too late, it really won't, help you. So really, I mean, this is a generalized, answer to this question, but really, if you're thinking about doing any type of fertility treatments, whether it be Clomid, Letrozole, injectable medications, it's really important to track your cycles with the app, and just basically have that information, whether you have whether it's normal for you, or you have completely normal cycles, or they're completely all over the place. Tracking them will help us understand, as your fertility team, how we can kind of, what to expect, basically. But yeah, if you're like not sure about kind of when you start your period and that kind of thing, then Letrozole could be kind of hard, because like I said, we want to make sure that we give you that medication when it's actually going to be the most beneficial to you. So so that would be kind of my only thought process. And some physicians give you Clomid first, and then if Clomid doesn't work, then they give you Letrozole. There's different dosages of Letrozole that you can start on. And so there's about actually 3 different dosages that they can give you. So if you started Letrozole and it didn't work, they can actually bump up that dosage. So that doesn't mean that Letrozole won't work for you. So there's kind of some different things that you can try to see if Letrozole is an option. But yeah, I'm definitely not anti-Letrozole. And I guess just really following your doctor's kind of advice and exactly how to take it, and following that is really going to be vital to your success. And then, like I said, tracking your cycles on your own, using the app, and taking the LH kits can be really beneficial.
Okay, and really quick follow-up to the previous question.
Okay.
She was the one asking about BMI. She said actually her doctor did tell her to lose the weight and then come back. So if the resources are not provided, any suggestions on where to find resources to help with that?
Yeah, so I mean, we talked about a little bit at our last. We did a panel a couple of days ago. I don't know if it's posted on the app yet. It was just it was Friday, right? So it was just a couple of days ago. But we talked about weight. So I would definitely check that out. Weight and fertility. There's a lot of really good resources on that. But one of the panelists talked about simply just calorie counting. But I will say this, that there are a lot of people who I struggle with my weight too. There's lots of people who have never been able to find something that works for them, and I totally understand that. So increasing exercise and calorie counting, and kind of decreasing how many calories you have, but maintaining a healthy calorie, count based off of your weight and all of that is important. But if you have tried like everything underneath the sun, I don't recommend like diets or like these fads, or even keto diet. We talk about that on the panel. We don't recommend anything like that. My biggest thing is that if you've tried everything you can, like you really have made an effort and it's nothing's working, then see a weight management place. That is going to be probably the best kind of support for you. Usually your insurance covers it because your insurance wants you to be healthy, right? So because they have to pay less money, it's all about money, but so they want you to be healthy. So your insurance company will cover it. And hopefully, you know, a lot of these places are in, you know, I live in Southern Indiana, but I'm just a few minutes away from Louisville, and we have like 2 major weight management centers in Louisville. So if you have, you know, a kind of city that's close by you, more than likely there's a weight management center. And like I said, your insurance company will cover it. And just having basically, you know, a lot of people don't want to say that they need help, but once you get that help, you realize how encouraging it is to have a huge team of people behind you, giving you tips, checking in with you, providing some accountability to make sure that you're staying on track and that kind of thing. It can be hugely successful. So if you really want to have IVF, you know how much weight you need to lose, go get help. That's what I would suggest. It doesn't, and like I said, it doesn't mean that you need help. You may just need to do some calorie counting and increasing exercise, but it's totally okay if you need help, because like I said, it's really beneficial to have more than one person behind you kind of encouraging you and giving you tips and tricks to make it actually happen.
Awesome. I'm going to do a quick answer for this last question, but feel free
Okay.
to add on, and then also just any last tips before we wrap up. They're
Yeah.
asking about unexplained fertility and stress management. And I just wanted to mention that we did team up with a great program called Organic Conceptions. You can find that right in the app if you look under more, and I think it's stress-free fertility. There's a quiz there you can take to learn more. So that's just one of many options to relieve stress. But we've found, I've actually gone through the program. It's an amazing program. I can see the value of the science, the research behind it. So be sure to check that out. Do you want to touch on that too, Brianna? And then any last tips for those who are stressed and also just struggling to conceive in general?
Yeah, I mean, I feel like I've just said this over and over again, but stress and then money is the biggest issue with fertility treatments, and stress over money leads to more stress. So it's just a repetitive cycle. So I mean, I personally think that money was the biggest stress to IVF. So doing your research and kind of doing what needs to be done to figure out like kind of the money side of things. Like I said, calling your insurance company, seeing if you have coverage, looking into IVF grants, looking into IVF, financing. Hey, friends and family, if you've got grandparents out there that they really want a grandbaby, hey, it doesn't hurt to ask. They may say no, it's okay. So there's a lot of things, I know people who create like kind of GoFundMe accounts to try to, or they do fundraisers to try to get money. I know couples who have sold T-shirts and, done all sorts of things and to try to achieve it. So it's really basically, how bad do you want it? You just gotta get in there and do the work. But not doing anything is going to make you more stressed out. So it is one of those things that you've got to act upon, and you kind of got to do something, whether it means to seek help, like what you were talking about, all these different kind of things that you can help, and basically looking at your own self, what things don't, help you relieve stress, and thinking about that. And I did mention this last time, and I'll say it again. Sometimes it does mean taking a break, taking a fertility TTC break. Okay. And sometimes that can be really powerful. I can't even count how many times patients have taken a break from months and months or years of trying to achieve, taken a break. The holidays are a great time to take a break, to not worry about, whether you're getting pregnant or not. Having intercourse that's fun. Everybody knows what I'm talking about. So, I mean, it can become a job when you're trying to get pregnant. So, all of those things, you know, taking a break it can be a really powerful thing. I don't necessarily say that you have to achieve pregnancy, but I'm just saying that, like, if you'll know as I'm talking, you're probably thinking about, oh my gosh, I've been so stressed out. I'm so sick of taking LH kits. I'm so sick of taking pregnancy tests. I'm so sick of monitoring every symptom and every cycle. That might be you. You might be somebody who needs a break. And it can be just 1 month, you know, you take a break and get right back on it. And it can do so many things for you. It can kind of just rejuvenate your mind and help you kind of get back to where you need to be, and know that, you know, this is something you want to do. And just don't give up though. You know, taking a break doesn't mean giving up. That's not the same thing. It means taking a mental break, a physical break from the process, because it is a roller coaster of emotion going through this whole process. It can be super frustrating. You constantly have hope, and then you constantly have, you know, a lack of hope, basically. So it is a roller coaster of emotion, but like I said, getting people behind you to help you, relieving stress how you can, taking a break if you need to, are all super beneficial. And just know that, you know, you have this amazing group of Premom, you know, experts here to help you. And then also in this group, you have so many women supporting you and encouraging you, and use those things. And you know, and like I said, just don't give up. You've got this. And pregnancy can be achieved. You just have to take no for an answer, you know, or say no is not an answer. Sorry. But you know, and just don't give up. Keep going. Use whatever methods you need. If you need to seek fertility treatments, you need to seek fertility treatments, you know. However you need to go about to achieve pregnancy, whatever is right for you will be right.
Thank you so much, Brianna.
Yeah, it was fun.
Just as Brianna said, you can find her right in the app under schedule consultation. Just wanted to remind you of that again. So please be sure to check that out if you feel like you could benefit from a consultation to go a little deeper with your particular fertility experience. Thank you all for participating live today, and we'll see you again soon.
Thank you, everyone. Bye.